Good morning. How are you doing, Rachel?
I'm good.
So we are going to do a very complex secondary revision rhinoplasty. She had in 2008, she had a bad motor vehicle accident, actually motorcycle.
Yes,
right?
motorcycle.
Without a helmet, you're lucky to be alive.
I know.
You can see, she had a very severe injury. Actually, you lost all your teeth, correct? And
Yes.
really almost avulsed your whole nose and lots of abrasions. And you can just see here she was pre-op before anything. So. And the goal, obviously, now is to fix this. And what are your top three concerns?
Symmetry, definitely. The ridge here, the way that my nose doesn't come in anymore.
Right.
And breathing.
Breathing,
Probably.
Yeah, I mean, she's got a very deviated nose, and of course, we're going to fix her breathing. She's got a notched ala, and she can't breathe, and she's got tattooed pigment of her dorsum, and I'm gonna have to excise that scar and so you know, a little scar there, but that's, I guess, pavement or roadway.
The scar tissue in here is probably.
Yeah, and we'll fix that too. And then of course we'll and then she has a lip discrepancy here, her remain cutaneous border, and we'll fix that as well at the end, and we'll dermabrate it. 35-year young female from West Texas, had a very bad motorcycle accident. She was an unrestrained passenger in a vehicle motorcycle accident. She had avulsion of her upper lip and also very bad nasal injury, avulsion of some of her skin in this area. She has a significant secondary deformity, deviated nose, dorsal hump, and really significant nasal airway obstruction here. And of course, this is her pre-op before any injuries. She's a beautiful young lady, and this is a photo of her in the emergency room. This is in the early 2008 and 9, and we're gonna fix her. We're gonna straighten her nose. We're gonna excise this area and get her functioning better, remove the dorsal hump, refine the tip, and we'll revise her remain cutaneous border as well, and so much more. She has significant periapical hypoplasia along with her other injuries. So what we will do in this area, we'll inject in a circular manner calcium hydroxyapatite or radius. This is blended. This will build up her base, and we'll do this bilaterally. You can see her incredible lip discrepancy, remain cutaneous border. It's been totally displaced. We're gonna remove the scar and bring this remain cutaneous border with the displaced one, and you can really see it in her photos here, and that will make a remarkable difference. Severe secondary nasal deformity, deviated nose, previous lip deformity and laceration dorsum, correction, secondary rhinoplasty, tip shaping, scar revision, complete lip revision, dorsal tip shaping, septal extension graft, retrograde alar contours, alar bases, and so much more. Secondary nasal deformity, trauma, dorsal hump, deviated nose, alar notching, correction, lip reconstruction, septal reconstruction, septal extension graft, tension spanning sutures, retrograde alar contours, scar revision, dorsum of nose, and more. Severe secondary nasal deformity, alar notching, alar flaring, boxy tip, correction, septal reconstruction, complete tip shaping, septal extension graft, retrograde alar contours, alar bases, and more. So Rachel is an amazing young woman, and would you tell us about your story about your trauma?
Yeah. So in high school, I had a ridge on my nose. I had a deviated septum. So I went to a doctor to have a rhinoplasty septoplasty. What happened was my nostrils ended up collapsing and the breathing wasn't improved. So we went in a second time to have that redone, and we took cartilage from my ear.
This is after that, or?
This is before. This is
that?
pre any surgeries. Okay.
So, and then I think you did relatively fine. Then you had a bad motorcycle.
Then I had a motorcycle accident in 2009.
Okay. And this
lots
was taken
of trauma to the face.
Yes, and you can see that was taken in the hospital.
Yes. Scraped my teeth off, broke my nose, cut my lip in half from inside my nose down and around my lip area. Yeah. That was awful.
Yes, and you had a head injury too. And
I did. The curb is what stopped me from sliding. Oof. So
they thought she was
no
longer alive.
Yes, right? The person that I was with, I think, thought that I was dead because I was unconscious for so long. So instead of calling 911, he took the motorcycle and hit it and put me in my front yard. We wrecked like 3 houses away from being home.
Oh, this is in West Texas, right?
It was in Lubbock.
Love it. Wow.
Yes, 2009.
You're a survivor.
Yes.
You've used one of your 9 lives. So
I know. I know.
You only have 8 left. So.
Risk adverse.
So when I met you, you know, she had a very deviated nose. She had tattooing. She had lost this skin here. She had dermal tattooing. She had a road tattooing. Very, very deviated nose. You can see when you look straight ahead. It was very, very tattooed. And then her lip, believe it or not, had not been ever fixed. So we actually rotated. It was like a rotation advancement. So I fixed that. And I revised the scar, did her entire septum and dorsum and softened it. And, you know, she's only 10 days, but you can see it's a pretty dramatic difference.
It's going to be so good.
Yeah, and you can see on the side view, too, that when you look over the side that, you know, we've softened it, taken the bump down. We straightened your nose, brought your tip up, and shaped it. Yeah, it was very traumatic on the inside. A lot of scar tissue, so it was badly done.
I thought so.
But, I mean, it was, you know, it was fine. I mean, we had to use rib graft to shape it, and this will all go down. It'll take 2 years to see the final result, and this will look awesome. You know, and just, you know, getting your lip finally in the right perspective. So.
Yes. Thank you.
You bet.
So much.
It's my pleasure. And then, you know, then we'll get you on some amazing skincare. And you know.
You said 10 months.
10 months, yeah.
I'm coming back.
Okay, we'll do the laser. Yeah, we'll do the laser. Yeah, 6 to 10 months. So,
Yes.
Okay. All right, so I'll see you in about 6 to 8 weeks. Okay.
Thank you.
All right, you bet.